In the bustling city of New York, Tom, a college student with ADHD, struggles to stay focused on his studies. His roommate, Mike, suggests he take some pills to help him concentrate. Tom asks, "What medication can I take for my ADHD?" Mike replies, "Adderall or Ritalin are blank medications used to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy. They increase alertness, attention, and energy. A. Benzodiazepines. B. Stimulants. C. Depressants. D. Selective serotonin reuptake inhibitors." B. Stimulants such as Adderall or Ritalin are medications that work by increasing the levels of dopamine and norepinephrine in the brain, which helps improve focus and attention. Depressants would not be the correct answer, as they have the opposite effect of stimulants, causing drowsiness and sedation. Selective serotonin reuptake inhibitors are a type of antidepressant that works by increasing serotonin levels in the brain. While they may be used to treat anxiety and depression, they are not commonly used to treat ADHD or narcolepsy. Benzodiazepines are a type of medication used to treat anxiety and sleep disorders. They have a sedative effect and would not be used to treat ADHD or narcolepsy. In the psychiatric ward of a hospital, Jack, a patient diagnosed with bipolar disorder, is experiencing a sudden and intense shift in mood. He feels elated and euphoric, but moments later, he becomes depressed and irritable. The nurses quickly intervene to provide him with medication to stabilize his mood. What type of medication should Jack be given to manage his bipolar disorder? A. Antipsychotics. B. Mood stabilizers. C. Selective serotonin reuptake inhibitors. D. Stimulants. B. Mood stabilizers. Mood stabilizers, such as lithium or valproic acid, are the best treatment option for Jack's condition, as they are specifically designed to manage the intense mood shifts associated with bipolar disorder. They help regulate mood swings and prevent extreme highs and lows. Stimulants increase energy and can exacerbate manic episodes. Antipsychotics are primarily used to treat symptoms such as delusions, hallucinations, and disordered thinking, but may not effectively manage mood shifts. Selective serotonin reuptake inhibitors, SSRIs, are antidepressants that may be prescribed in combination with mood stabilizers, but alone, they may not be effective in treating the manic symptoms of bipolar disorder. A social worker, a psychiatrist, and a nurse are part of an interdisciplinary team at a psychiatric hospital. They are reviewing the medication chart of a patient who has been diagnosed with schizophrenia. The social worker is a little confused by the long list of prescriptions and asks the psychiatrist, which of these medications is not an antipsychotic medication? The psychiatrist would most likely respond, A. Aripiprazole, Abilify. B. Quetiapine, Seroquel. C. Sertraline, Zoloft. D. Risperidone, Risperdal. C. Sertraline, Zoloft. Sertraline, Zoloft, is not an antipsychotic medication. It is a selective serotonin reuptake inhibitor, SSRI, used primarily to treat depression, anxiety, and obsessive-compulsive disorder. Quetiapine, Seroquel, Risperidone, Risperdal, and Aripiprazole, Abilify, are all antipsychotic medications commonly used to treat schizophrenia and other psychotic disorders. Quetiapine and risperidone are atypical antipsychotics, while aripiprazole is an atypical antipsychotic with partial dopamine agonist activity. Emily, a young lady at a mental health facility, is battling depression. To assist her in managing her symptoms, an antidepressant medication has been suggested, but she is unsure of which one will be most beneficial for her. One of the remedies her doctor suggested is a particular class of antidepressant medication that prevents serotonin from being reabsorbed by neurons, essentially increasing the amount of serotonin that is available for use as a neurotransmitter. What kind of antidepressant medication is Emily's doctor explaining? A. Serotonin and norepinephrine reuptake inhibitors, SNRIs. B. Benzodiazepines. C. Selective serotonin reuptake inhibitors, SSRIs. D. Antipsychotics. C. Selective serotonin reuptake inhibitors, SSRIs. Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed antidepressants. They work by preventing the reuptake of serotonin, a neurotransmitter that regulates mood, appetite, and sleep. By increasing the availability of serotonin in the brain, SSRIs can help alleviate symptoms of depression and anxiety. Serotonin and norepinephrine reuptake inhibitors, SNRIs, are also antidepressant drugs, but they work by inhibiting the reuptake of both serotonin and norepinephrine. While SNRIs may be effective for some patients, they are not the best choice for Emily, as her doctor specifically mentioned a drug that targets serotonin reuptake. Benzodiazepines are not typically used to treat depression. They are a class of drugs that act as sedatives and are often prescribed for anxiety, insomnia, and seizure disorders. Antipsychotics are used primarily to treat psychotic disorders like schizophrenia and bipolar disorder. While some antipsychotic medications can be used as an adjunct treatment for depression, they are not typically the first-line treatment for this condition. In the midst of a bustling art fair, a 37-year-old man named Michael walks around, his eyes bright and alive with excitement. The booths and installations around him are a blur as he thinks about his plan for his ambitious art project. Suddenly, he strips off his clothes and runs through the fair, where he begins to dance and chant in front of a group of onlookers. The police are called, and Michael is taken to the emergency room. When the social worker speaks with him, Michael talks rapidly, seems euphoric, and insists that his artwork is going to transform humanity. With careful questioning, the social worker discovers that Michael has a family history of bipolar disorder and was recently put on medication by his psychiatrist. What medication was Michael most likely given? A. Depakote. B. Lithium. C. Ativan. D. Citalopram. A. Depakote. The man's symptoms suggest that he is in the manic phase of bipolar disorder. Depakote is a medication that is commonly used to treat manic episodes, making it the most likely medication he was given. Lithium is another medication commonly used to treat bipolar disorder, but it is less likely to be the correct answer in this scenario because the man's symptoms are more indicative of mania than of depression. Ativan is a medication used to treat anxiety and is not typically used to treat bipolar disorder. Citalopram is a selective serotonin reuptake inhibitor, SSRI, that is used to treat depression, but it is not effective in treating the manic phase of bipolar disorder. Lily is a young single woman who lives in the vibrant community of Willowdale. However, Lily struggles with major depressive disorder and chronic pain, all of which have contributed to her growing addiction to nicotine. Her doctor prescribes her medications to alleviate her symptoms and improve her quality of life. Which group of medications would most likely be prescribed to Lily? A. Mood stabilizers. B. Antidepressants. C. Antipsychotics. D. Stimulants. B. Antidepressants. Antidepressants are medications commonly used to treat major depressive disorder, some anxiety disorders, and some chronic pain conditions. They can also help manage some addictions. These medications work by balancing certain chemicals in the brain that affect mood and emotions. Stimulants are medications that increase activity in the brain and are commonly used to treat attention deficit, hyperactivity disorder, ADHD, and narcolepsy. They are not typically used to treat depression or chronic pain. Antipsychotics are medications used to treat conditions such as schizophrenia, bipolar disorder, and severe depression. They are not typically used as a first-line treatment for major depressive disorder or chronic pain. Mood stabilizers are medications used to treat conditions such as bipolar disorder and sometimes major depressive disorder. While they can be effective in treating depression, they are not typically the first choice of medication for chronic pain. John, who is 35 years old, has been having anxiety and panic attacks for a few months now. He has trouble sleeping at night, which is having an impact on his employment. One day, he decides to get help from a psychiatrist named Dr. Smith. During the appointment, Dr. Smith suggests that John take medicine to ease his symptoms. He says that the medicine can make it easier to sleep and reduce anxiety symptoms like panic attacks, extreme fear, and worry. Dr. Smith further explains that this medication can also be used to treat seizures and alcohol withdrawal, as well as to relax muscles and put people to sleep before surgery or other medical procedures. Based on what Dr. Smith said, which of the following drugs is most likely to be the one he will give to John? A. Benzodiazepines. B. Antipsychotics. C. Mood stabilizers. D. Selective serotonin reuptake inhibitors, SSRIs. A. Benzodiazepines. Benzodiazepines are a type of medication that help reduce the symptoms of anxiety, such as panic attacks or extreme fear and worry, and make it easier to sleep. They are also used as a muscle relaxant, to induce sedation for surgery and other medical procedures, and in the treatment of seizures and alcohol withdrawal. Benzodiazepines are often the first-line treatment for anxiety disorders due to their fast-acting nature and efficacy in reducing acute symptoms. Benzodiazepines work by enhancing the effects of a neurotransmitter called GABA in the brain, which helps to calm the nervous system. Antipsychotics treat psychosis such as delusions and hallucinations. They're rarely used to treat anxiety or panic attacks. Mood stabilizers are used to treat bipolar disorder, which involves periods of mania. Depression and anxiety are treated with SSRIs, but take weeks to work. While mood stabilizers, antipsychotics, and SSRIs can be used in the treatment of anxiety disorders, they are not typically the first choice due to their slower onset of action or different mechanism of action. In the TV series, Grey's Anatomy, Dr. Grey is treating a patient with bipolar disorder who is experiencing severe mood swings. She needs to prescribe a medication that effectively stabilizes mood. Which of the following medications would be the best choice for her patient? A. Lithium. B. Fluoxetine, Prozac. C. Buspirone, Buspar. D. Alprazolam, Xanax. A. Lithium. Lithium is a mood stabilizer that has been shown to be effective in treating bipolar disorder by reducing the severity and frequency of manic and depressive episodes. It works by regulating the levels of certain neurotransmitters in the brain. Buspirone and alprazolam are both anti-anxiety medications. Buspirone, Buspar, does not have mood-stabilizing effects, and alprazolam, Xanax, is not used as a primary treatment for bipolar disorder. Fluoxetine, Prozac, is an antidepressant that is used to treat depression but can worsen manic symptoms in people with bipolar disorder. Therefore, it is not the first-line treatment for bipolar disorder. A patient with delusions and hallucinations related to schizophrenia receives risperidone from a psychiatrist in a mental health clinic. Risperidone is a medication from the second generation of a certain class of pharmaceuticals. Which class of drugs does risperidone belong to? A.
Antipsychotics.
B. Stimulant. C. Antidepressant. D. Selective serotonin reuptake inhibitors, SSRIs. A. Antipsychotic. Risperidone belongs to the class of drugs called antipsychotics, also known as neuroleptics, are a class of psychotropic medication primarily used to manage psychosis, including delusions, hallucinations, paranoia, or disordered thought, principally in schizophrenia but also in a range of other psychotic disorders. Antipsychotics work by blocking dopamine receptors in the brain, which helps to reduce symptoms like delusions and hallucinations. Stimulants are a class of drugs that increase activity in the brain and body and are primarily used to treat conditions such as ADHD and narcolepsy. Antidepressants are a class of drugs used to treat depression and other mood disorders and work by altering the levels of neurotransmitters in the brain, such as serotonin, dopamine, and norepinephrine. SSRI, selective serotonin reuptake inhibitor, is a type of antidepressant medication that primarily works by increasing the levels of serotonin in the brain. It is used to treat depression, anxiety, and other mood disorders. In a busy hospital, a social worker sits across from a client in a sterile, white-walled room. The client, a middle-aged man named John, has a history of depression and has already tried selective serotonin reuptake inhibitors, SSRIs, and norepinephrine dopamine reuptake inhibitors, NDRIs, with no success. John's psychiatrist enters the room and joins the meeting, and the social worker asks what the next best pharmacological therapy could be. The psychiatrist considers John's medical history and current condition before recommending which medication as the best option. A. Tricyclic antidepressants. B. Antipsychotics. C. Mood stabilizers. D. Acamprosate. A. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, are often prescribed for patients with depression who have not responded well to SSRIs or NDRIs. TCAs work by inhibiting the reuptake of norepinephrine and serotonin in the brain, leading to increased levels of these neurotransmitters and improved mood. While TCAs can be effective, they can also have significant side effects, such as drowsiness, dry mouth, and constipation. Therefore, careful monitoring is necessary. Antipsychotics are not appropriate for John's case because they are typically used to treat psychotic disorders such as schizophrenia, rather than depression. Mood stabilizers are commonly used to treat bipolar disorder, which is characterized by episodes of both mania and depression. While they can be effective for some patients with depression, they are not usually the first-line treatment for unipolar depression. Acamprosate is a medication used to treat alcohol dependence and would not be an appropriate choice for treating John's depression.
Congratulations on answering the practice questions. You're one step closer to becoming a more effective and knowledgeable social worker. I hope this video has been helpful in deepening your understanding of social work license exam questions. If you're interested in taking your studies further, I invite you to join me for a 90-minute session where we'll dive deeper into the various content areas and practical application. When you sign up, you'll also receive my 70 Social Work Practice Exam Question ebook and my Strategies for Success activity book, both of which will help you continue your learning journey. The link to sign up is in the description below. I look forward to studying with you and helping you become the best social worker you can be. Thanks again for watching.